Everyone, once again welcome to my Oet channel. Today we will see another one role play card which appeared in our last September exam. So this is the role play card of 2022 September exam. So in this role play card we can see that I have marked some of the points in red pen. So this is the way you have to do it in your exam. So in 3 minute examination, 3 minute preparation time, when you will get, you can maximum utilize your paper. Whatever you want, you can write there, and whatever you can mark it, you can mark it there. And if you want to write any connective words or something, like I said, a simple sentences, you can write it over there. And the important thing, first you have to go to the settings. So this is a general practice. That means it is nothing but community health center. General practice means same thing only, like GP's office. And then you have to go to the nurse's role. This section, it is very much important for your exam, because you have to imagine by yourself what is your role. Then only you can productively act in the role play. Here you can see, you see a 23-year-old patient who was recently diagnosed with eczema. So you can underline eczema. He or she has never experienced skin problems before, and so was shocked at this diagnosis. That means, so you have to see the hidden meaning also. That means this patient came to GP for skin problem, and doctor has diagnosed that this problem is eczema, but patient is shocked by hearing this diagnosis. He or she has been referred by the doctor for eczema management advice. Now, this patient came to you to get some more information regarding eczema and its management. So, already patient knows that she is diagnosed with eczema. Now, you are going to explain the things, what are the managements and what are the preventive measures. So, now you have to imagine that you are sitting in a GP's office, nearby the GP's office, and one patient came to you, and you have to think that after doctor's consultation that information will come to your system, or at least you will have the paper or document regarding this patient. So now you have the paper. Then the patient, when the patient comes to you, the first task is confirm. That means with your paper or with your system you have to confirm that this is the patient who is referred by the GP for eczema management, advice regarding eczema management. You have to think like this way, or else your introduction will be wrong. So we will see. The first thing is confirm reason for patient's visit, that is eczema management advice, and find out what patient knows about eczema. So here we have to subtask. Confirm. See the term. This is peculiar in 2022 role plays. When the term confirms come, you have to ask, or you have to confirm that this is the person, right person to explain this thing. How we can ask example. Good morning. I am Rashmi Rajan, one of the restored nurses working in this general practice. How may I address you? Or we can ask, may I know your complete name? Then the patient is telling the name. Example, the patient name is Rose Williams. Then we can tell that, if I'm not wrong, from my system, I can see that you have been diagnosed with eczema and you are here to get further information regarding eczema management. Am I right? So this is the way you have to confirm the case. Then the patient will tell that, yes, sister, actually, this is the reason I came to you. I am so much shocked by hearing the diagnosis eczema, because this is the first time I am hearing or I am diagnosed with the condition. Find out what patient knows about eczema. That is the second one. So we have to ask, before proceeding further, Miss Rose, may I know, do you know anything regarding eczema? Then the patient will answer, no, sister, actually, I don't know anything, because the doctor told me something, but really I could not remember anything right now. Then we can give the reassurance. Well, Miss Rose, no need to worry. I am here to explain for you. Your condition is nothing but this is a chronic inflammatory condition, and which causes itchiness, dryness, and cracked skin. And it is a sudden onset. It is common among adolescent and early adulthood people, and the real cause is unknown. So this is explanation we will give, and no need for any unwanted explanations. Only wanted explanations within a short sentences is enough. If you are going for extra explanations, of course, at the last you will not get the time for conclusion. So keep it in your mind. Simple explanation is enough. Then the next question is explain there is no cure for eczema, but condition can be managed. From here, you can think that there is one question, and this is the answer for the question. So you can ask, Miss Rose, do you have any other concern regarding eczema? Then she may ask, Sister, I just want to know that what is the management and how I can cure it. Then we can tell, we are telling that there is no. If you want to use no, there should be what phrases. I will tell you that really, I'm sorry to tell you that actually there is no cure for eczema, but no need to worry. This condition can be managed. If you are telling, I'm sorry, that means you are telling something negative, but you have to give the reassurance in a positive way. Always keep it in your mind. But no need to worry, your condition can be managed. And you can tell about the self care. I would like to tell you regarding the self care management at home. You can do it at home even. Please take regular bathing and please use moisturizing cream, and it is essential for you to avoid perfumed soaps, and instead you can use non-perfumed soaps. And or you can tell, in addition, it is very much important for you to avoid scratching your skin. If you follow all these self-care activities, I am reassuring you that your skin problem can cure. You can get, not cure, you can make it, you can get rid of from the eczema, further eczema attacks. So like that you can tell, because in this section I want to tell you that most of the students will tell it's like in this way. You can tell it's like you how to, you need to take regular bath, and you need to avoid non-perfume. So this you need to, you have to, you should, these and all please try to avoid. Instead you can use please, and it is essential for you to, it is necessary for you to, it is important for you to, what you are using in the letter paragraph, in the recommendation paragraph, in the same way you can use it here also. Okay, then next one is the advice on importance of identifying triggers to prevent flare up, like allergens, stress, irritants, and explore any other patient concern. So here actually you can see that the patient is telling that, sister, really I hope it may be a simple condition, but the doctor told me that it is something like a serious, and you are telling that it is not curable one. Really, I am so much worried. Then you can tell that, don't need to worry, Miss Rose. It is important for you to identify the triggering factor, because it's like a unknown cause. For each and every person, it will be it will be different, and you can just observe yourself in which situation your eczema it is flaring up. Sometimes there will be some allergens, and maybe your stress level is increasing, or sometimes some irritants like a food or something, or sometimes it can be a climate also. So first of all you have to find out the triggering factors, then you can avoid such triggering factors. So I hope if you find out your triggering factor and your maximum, if you can avoid, of course your condition can be managed very well. So that is the thing you will tell in that sentence. Then the next one is resist request for prescription of cream. So that means there is a hidden question. You are asking something and patient is asking for the prescription, right? So you have to imagine each and everything within that 3-minute preparation time. So you can ask, Rose, I hope I have clarified your doubts. Still you have any doubts, or still you have any concern? Then she's telling that, sister, really, I hope the doctor may prescribe some prescription. He may prescribe some creams, at least any creams or oils. But he didn't do anything. He just sent me to you for the advice and regarding some suggestions. But if you don't mind, could you please prescribe me some creams? Like that patient may ask. Then you can tell, Miss Rose, really, I'm sorry to tell you that I am not the right person to prescribe you any medication. This is upon doctor's decision. And here, since doctor didn't prescribe you anything, and it is not at all needed for you, instead you can go for self-care advice, and what are things I explained, you can do that. And of course, if there is no improvement after some days, you can come back and we can make an appointment with your GP, so that he can give you some medications. Is it okay for you? Like that we can ask. Then the patient will tell, okay, sister, I will try for the self-care advices, and let me see if there is no improvement. Of course, I will come back. Then we can conclude. Okay, Mr. Rose, I hope I have clarified all your doubts. If you don't have any other clarifications, I can give you some brochures regarding the self-care treatment for eczema. I hope it will be helpful for you, and I wish you a speedy recovery for your condition. So, like that, we can wind up the sentences. So, this is the example, like a model questions and answers of this role play. In this way, we can present it because it is a GP's office and the patient is normal patient, and you are giving some reassurance because the skin condition and the patient is 23 years only, so the patient may have more concern regarding the skin and the beauty, everything. So you can give just like advisors, then it's like a reassurance. The reassurance is essential for all role plays, even if it is in home visit or in GP's office or clinic or hospital, wherever the scenario. Reassurance is very much important because in that way only you can convince the patient. And once if you can convince the patient means you are succeeded in scoring. So please keep it in your mind to be with the role play card, and sometimes the interlocutors may not be active, maybe active means maybe they will just talk with you, not like in an active way. But you have to be active and you have to act in that role play in the real. You have to think about this like a real scenario, and you are getting one patient in front of you. So how you will do it in your profession, in the same way you have to show the sympathy and empathy, and when you are giving the suggestion should be like a sympathetic way and should be in a polite manner. Don't use should, you need to, have to, these everything. Instead you can use in a polite manner. And the introduction and conclusion is very much important. And still, if you have any problem with the speaking, please go to my YouTube playlist for speaking, and there are a lot of advices and tips are there. You can follow everything, especially for the introduction and conclusion. I have made two separate videos, you can refer that. And there is telegram group, and I have given the link in the description. If you still have any problems with the writing, if you need any suggestions or if you have any queries, you can type it in that telegram group. I am there to help you. So I hope it is clear for you and it is beneficial for you. We will see you with another one informative role play. Until then, bye, take care.